I'm Dr. Jim Domzalski, and I'm a chiropractor practicing in Venice for the past 36 years. So I guess that means I must have started when I was about 13. Well, I have the pleasure today of speaking to you about caring for your back. A lot of what I'm going to say is probably common knowledge and things that you've heard already, but I maybe will be putting a different spin on it for you. When you injure your back seriously, you know pretty much exactly how you did it and when you did it. You may have had an auto accident, you might have fallen down and tripped or picked up a heavy weight that you weren't expecting to be so heavy, and boom, there it is. Now you got the consequences. But oftentimes, patients tell me they don't remember when they injured their back or how they injured their back, but it's been a long time and they've been having a lot of pain and discomfort and stiffness, and it just never seems to go away. So at that point, I have to become a detective and figure out what kind of things are these people doing that might be causing their conditions to continue like that. So I'm going to talk a little bit about how the spine works, how your back works, how it functions, the mechanics of the spine, to give you a perspective on what happens when we do various things the right way or the wrong way. The spine is responsible for holding us up. It's the vertical support of our whole body. It holds our head, it holds our arms, shoulder girdle, and it supports all of our organs. It enables us to be able to walk upright. It's comprised of 25 segments with a little bit of movement in between each one, which enables us to bend, twist, turn, and all the various movements that we do in our life. There are three curves in the spine, the cervical curve, the thoracic area, and the lumbar spine. They each have a little bit different characteristics. One thing in common with all of them is there is this area, this is an example of vertebrae, and here is the disc in between that cushions the individual vertebrae. This is where most of your weight and stress is absorbed. In the back, we have these fine, delicate joints that guide the spine through their various movements and restrict the movement so that you don't move too much. Another vital function of the spine is to protect the spinal cord. The spinal cord, which runs through the middle of the spine like this, is responsible for carrying messages from the brain to the whole rest of the body and back again. So it enables us to move. It controls our organs, heartbeat, lungs, and lots of our body functions. So with all these nerves in the spine, any kind of injury to the spine is bound to cause us dysfunction or pain. Now, we've all heard about bending and how to do it correctly. The fact is, bending is really not much of a problem. Bending over is rarely a problem. It's the coming back up part that's the problem. And the reason for that is when you bend, these little joints, these delicate joints, glide and slide and open up. But when you come back, they slide and come together, and sometimes they bind. Sometimes they bind and they get very angry, and this is when you have an experience where people will say, "My back went out," because you can't stand up. So remember, when you're bending forward, if you can, find something to help you to come back up, but come back up slowly and carefully. Now, if you're bending forward and twisting, you're putting all of the stress on just one side, and that's even worse. So try not to twist and bend at the same time. Now, I haven't mentioned anything yet about lifting, and definitely there's a right way to lift and a wrong way to lift. The best way to lift is always get somebody else to do it for you. Now, if you insist on lifting something yourself, the thing to do is the problem is going to be that you're not only going to be grinding these joints, but now you're going to be putting weight and pressure on these joints, which gives you a much, much greater chance of injuring them. So keep the spine straight. Don't use those joints. Instead, use your knees and your hips to go down to the floor. Now watch this, I won't be able to get back up. And now carefully lift the weight, hopefully with somebody else on the other side of it if it's a big weight, and keep it close to your body. And then don't twist to put it down someplace. Turn your body and do it this way. This will help prevent most lifting injuries. Try not to do these things repeatedly, like loading a pile of bricks from here to there is the worst thing you can do. So another one that happens, another unexpected injury, is just from standing and maybe washing your dishes or weed whacking or something that you keep a position where you're just a little bit bent forward. We call it stooping for a long period of time. And you forget that you're not actually standing up straight. Half an hour later, it's like, oh, good, I'm glad that's done. Oh, and now those joints are stuck again. They're stuck because the fluid that's in the joint seeps out over time, and now you don't have any lubrication. So when they come back together, bang, you've got a problem. The answer is take frequent breaks when you're doing these kind of things like washing dishes or weed whacking. Make sure that you stand up every once in a while, every 5 minutes anyway, so that you don't get locked into position. One tip is if you are working in your kitchen, you can open a cabinet door and take one foot and put it in the cabinet. This will take a lot of the stress off the spine. You can then alternate feet. If you don't have an empty cabinet that you can put your foot into, you can always just put a block of something on the floor and do the same thing. Make sure you don't trip over the block when you forget that it's not there. For you gardeners, bending over and pulling weeds is murder. I suggest you get a rolling cart. I have one that you can just pick up and move, but that's even worse because you're hopping around. If you get a rolling cart, it'll take a lot of pressure off of all of your various gardening chores. And if you pull a lot of weeds, I suggest a stand-up weed puller. You won't believe how well those things work, and it'll take so much pressure off of your back. Another cause of chronic back pain is if your spine is imbalanced. For example, if you have one leg that's shorter than the other one. If you were injured or you were born with this situation, your body's probably compensated for it over the years. And if you try to correct it now, you're probably going to just imbalance yourself someplace else. But you can cause an imbalance by, for example, walking on a beach in a long distance in one direction where it's slanted. This will cause the same problem. It'll cause a stress in the lumbar spine, and you'll start to feel it. Another thing that will do it is if you walk with your feet turned out, one foot particularly turned out, that will function as a shorter leg, and it'll tilt your spine down. So take a look at your feet, see how you walk, and if you're toeing out, bring it in a little bit. Don't go to an extreme, or again, you'll start having hip pain and other problems. Take a look at your shoes. If your shoes are worn on the heels in the back, time for new shoes, because probably you were walking with your foot toed out and it wears the shoe, which causes you to walk with your foot turned out even more. So that's an important thing to watch for to keep your spine balanced. When we come up to the thoracic spine, we don't usually have as many problems there. The reason being, we have a rib cage that restricts most of the movement. So you can't really move the spine as much in that area. What we end up getting, however, is over time and gravity, this sort of hunched back appearance and posture. Try to remember to stand up straight and erect. Think about bringing your shoulders back. Avoid sitting in slouchy chairs that cause you to fall forward like that. When your shoulders come forward, they drag your spine down. A situation that will occur when you have a hunchback like that will be compression fractures, which are very painful which will cause your spine to bend forward even more, and that causes more compression fractures, so it's a vicious cycle. One activity we all partake in from time to time is sleeping. When I have a patient that says, I felt pretty good after my treatment, but then the next day it was back again, I woke up with it. I have to be thinking, that person didn't have a very restful sleep. So is there something they're doing while they're sleeping that is causing them this problem? Well, there is no one correct sleeping position. In fact, if you slept in one position all night, that would be a problem. Fortunately, most people move around. And this is good because it gives your joints a certain amount of movement and it lets your muscles take over for each other from time to time. Sleeping on your stomach is a problem because now you have to turn your neck all night just to be able to breathe. Sleeping on your back is very good as long as you have a pillow under your knees so that it flattens your back and your low back can contact the bed, and you have a pillow that holds your neck and holds your head. So, another problem with sleeping on your back, of course, is what do you do with your feet? If you have blankets or a sheet on, they're going to poke into the blankets or the sheet, so you're going to tend to turn your feet out, which, as we mentioned before, is not a really good idea. So that leaves sleeping on the side. Good news, you got two sides, so you can switch between one and the other. When you're sleeping on your side, be sure that you keep both arms in front of you. People have the tendency to put their arm underneath the pillow. This is one of the #1 causes of pain that comes in this area and throughout the shoulder. So keep your arms in front of you. Perhaps have a pillow to either hold on to or to rest the other arm on is a good idea. Pillows. Speaking of pillows, what's the best pillow? I don't know. I haven't found the best pillow yet. A lot of people say they have one, but there doesn't seem to be one pillow that fits everybody, and it certainly doesn't fit you all night long. If you sleep on your back, those pillows that have this sort of a contour are really good because you get support for your neck and you get something that cradles your head. However, as soon as you roll over on your side, you never have enough support. So, I recommend using a pillow that can be conformed to the way you sleep, that you can kind of work on and change as you need it. The proper thickness for a pillow, if you're lying on your side, is the distance between your ear and whatever part of your shoulder that's on the bed. And make sure you allow for the fact it's going to compress during the night. If it's any higher than that, it's going to push your head one way, and if it's any lower, it's going to push your head the other way, and you're going to wake up with a stiff neck. Now, what kind of bed is best? People ask me all the time, what kind of bed should I get? Well, there was a trend for a while that the bed had to be as hard as possible. Firm is the best. Well, this sort of comes a little bit from the idea that your old mattress was worn out and it sagged in the middle. The springs got worn out. And we sure don't want that because then you're going to sag in the middle and you're not going to get any support. But I think it would be hard to purchase a new bed that was actually too soft. They're all pretty firm. What you want to make sure you have is enough cushioning on the top so that each part of your body sinks in and is evenly supported. If you're a thin, bony person, you need to have a bit more cushion so that you don't have one part resting on the bed and getting aggravated while the rest of your body is trying to hold itself up. So you need a bit of a softer bed top. If you're a heavy person, you probably have enough cushion on you already. So you don't need as much of a cushion, but you still need some. Make sure that you're being evenly supported. Make sure you try out the bed first to make sure it fits you. There's no one-size bed that fits everybody. I hope that I've given you some insight and some tips that'll help you to take care of your back. It's been a pleasure speaking with you today.